Good morning, everyone. In last class, we discussed about the infrared radiation. Radiation definition of infrared radiation and what are the types of infrared radiation. There are mainly two types: luminous infrared radiation and non-luminous type. In this, what are the two types in mainly describe the luminous and non-luminous infrared radiation figures of the luminance and what are the physiological effects of the infrared radiation, adverse effect of the infrared radiation, and some laws related to infrared radiation. Now we start with today's topic of method of application. How the infrared radiation apply to the patient or particular bodies. Start with the method of application. The intensity of radiation should be low, but after 5 to 10 minutes, when the vasodilation has taken place and the increased blood flow, so strength of radiation may be increased. After 10 to when first we apply on the patient's skin IRR, the intensity of the IRR is high, so the patient feel the heat, and after 5 to 10 minutes when heat is more, so frequency should be low. Physiotherapist should be hand throughout the treatment session and should reduce the intensity of the radiation if the heat becomes excessive. At the whole treatment time, physiotherapist should be near the patient, and when the patient is asked for his feeling too much heat, so lower the frequency of the IR level. If radiation is extensive, it is desirable that sweating should occur to counteract and reduce the body temperature. In the more the heat is for feel the patient, the sweating is occur and it is the normal. Sweating is encouraged if the patient is provided with water to drink during the treatment. At the end of the exposure, the skin should be red but not excessively so. After the treatment, the skin areas should be red. Following the intensity radiation, the patient should not rise suddenly from the recurrent position or go out into the cold immediately. After the treatment, we ask the patient to do not immediately go out or should not rise from the bed. If the patient is suddenly rise from the bed, chances of occurring painless. So as the patient do after the treatment 5 to 10 minutes, I rest on the same position. Duration and frequency of the treatment. For acute inflammation or a recent injury, and for the treatment of wound and exposure of 10 to 15 minutes adequate, but may be applied several times during the day. And the condition like acute condition or a recurrent condition time should be 10 to 15 minutes per day wise, applied 2 to 3 times per day. Longer exposure may be used for chronic conditions. What are the therapeutic uses of the infrared radiation? Therapeutic uses. The first is decreasing pain. Decreasing pain is a effect with the physiological effect of first vasodilation of the tissue. When the vasodilation occurs, the content of the vessels are open and the pain is and the flow of the particular part is more, so the ultimately decrease in the pain. Increase blood supply, increase joint flexibility, increase in joint range of motion. Then further discuss there's increase in joint range of motion in a athletic person when prior to the any activity, so increase in the flexibility of a particular joint, so ultimately increase in the range of motion. Second is muscle spasm and muscle relaxation. Incisional wound, acceleration of healing, subacute and chronic inflammation of the musculoskeletal system, chronic mild to moderate edema prior to stretching and mobilizing exercise, some skin condition, duration of the treatment application ranges. So we discuss about the therapy uses. So first is decrease in pain, increase blood supply, increase joint flexibility, muscle spasm, muscle relaxation, incisional wound, accelerating of the healing. To the incisional use after the skin is ready to heal. So then we apply the heating. It helps to recovery in fast. Subacute and chronic inflammation of the musculoskeletal system, chronic to mild moderate edema, prior to stretching and mobilization exercise, some skin condition, and fungal infection. What are the contraindications of the IUD? So peripheral vascular disease with compromised circulation, impaired circulation, over a tumor. Third is acute inflammation. Fourth is acute infection. Fifth is open wounds. Sixth is impaired sensation. Seventh, over pregnant uterus. Eighth is eyes. And ninth is metal. These are the contraindication of IRR. When we not use IRR to a particular condition. This is the over a tumor, acute inflammation, acute infection, wounds, impaired sensation, over a pregnant uterus, eyes, and metal. What are the hazards and dangers of the IR? The first in hazards, burns is the main hazards and danger of burns. The main danger of fire is burn. It is occur if it is too intensive. Heat means the more chances of to burn. The patient is not fully aware of the level of heat. Before the beginning, do not explain the whole procedure of the treatment to the patient. So it is more chances to patients burn. The patient is unable to communicate with physiotherapist when the patient feel heat and communicate with the therapist to it is more or less. So it is chances to burn. Second is eye damage. The eye should be covered with a light towel or a heated turned away during the application of IR to avoid eye surface dryness or a possible irritation. And this when the treatment in particular left side or right side. So when the patient is initially shoulder right side patient is having pain. So applying in IR on right shoulder. So ask the patient to turn the head on the left side. So eyes should be not affected during the IRR length. Third is electrical shock. It can occur as a result of touching some exposed part of the circuit, but the chief danger arises if the live wire comes in contact with the apparatus causing. In case when the apparatus is not properly checking by the therapist, when the danger arises in the live wire comes with the contact with the apparatus causing the electric shock. Fourth is a gangrene. By applying the IR on the area with defective arterial blood supply is the same as SWD. SWD, there are so many contraindications. In this contraindication, gangrene are also in gangrene. The arterial defective in gangrene are defective of the arterial blood supply. So when we apply IR, so it affects the area more. So next is headache. It may be follow IR, especially if the sweating does not occur or if the treatment is given during the hot weather. When we apply in the patient there is no sweating in the patient. So when the IR apply, the body temperature should be rise. So is the contraindication of the IRR. And when the apply patient in a summer or a hot weather, when we apply IRN in hot weather, so it is contraindicated. The patient should take a plenty of water to encourage sweating, and it is wise to discontinue extensive IR treatment when the weather is very hot. In very hot weather, we can mostly discontinue to apply the IR. You can avoid the IR at that time. Fine. Extensive irradiation is accompanied by a fall in blood pressure, which may result in blindness due to hypoxia of the brain. In the brain, hypoxia means hypotenuse decreased oxygen level in the brain. When we apply IR or a patient feel more blindness, so due to hypertension or due to hypoxia of the brain or a decrease in oxygen with a particular part. So patient occur faintness. It occurs when the patient arises suddenly from the recovering position after the excessive treatment. We further discuss that when the treatment is over, we ask the patient to lie on the same position 5 to 10 minutes so the faintness doesn't occur. Okay, revision of this class. What we discussed in today's lecture? So what are the application method of application IRM? What are the precaution tips for a treatment? What are the hazards and dangers of this IRR treatment? What are the indications and contraindications of the IRR treatments? And therapeutic uses of the IM. Duration and frequency. Duration, like acute condition, we apply for a 15 to 20 minutes. And the chronic condition, we apply 20 to 24 minutes for a 25 minutes or 2 to 3 minutes for a day. Can you have an question regarding this IR? IRR, what are the definition of IRR, types of IRR, what are the physiological effects of IRR, what are absorption of the IRR, method of applications of IRR, indication and contraindication of IRR, hazards and dangers of IRR. These all topics are covered in this lecture. Thank you so much.